Good morning, and thank you for the opportunity to present today. We know that HIV infection in children causes higher risk of infectious morbidity and hospitalization, and recent evidence suggests that children exposed to HIV and uninfected also have increased risk. With the success of prevention of vertical HIV transmission programs, there has been a global shift in the HIV exposure profile of children over time, particularly since the introduction of option B+ in 2013. So our aim was to describe the temporal changes in HIV-related characteristics of children up to 3 years of age with infectious disease hospitalizations across the Western Cape province in South Africa from 2008 to 2021. This retrospective population-based analysis used digitized individual-level routine healthcare data from the Western Cape Provincial Health Data Centre. Our study participants included children born in the Western Cape who had infectious disease hospitalizations by age 3 for one of these infectious diseases listed. The HIV-related characteristics that we looked at were child HIV exposure and infection status, timing of maternal HIV diagnosis, timing of maternal ART start, and maternal CD4 count and viral load near delivery. HIV-related characteristics were described over time by year of first infectious disease hospital admission, and we used regression to assess the changes in characteristics in the pre-option B+, option B+, and universal ART periods, respectively. So we included almost 53,000 children in our analysis, and one of the key features that I would like to highlight is the decrease in the proportion of deaths over time in children, highlighted in yellow, and mothers highlighted in blue. Am I doing something wrong? It's not changing. There we go. So here we are looking at the trend in the overall proportion of child HIV exposure and infection at hospital admission. In the grey line, we see that encouragingly the proportion of children with HIV decreased over time from about 8% in 2009 to between 1 and 2% from 2015 onwards. And correspondingly, the proportion of children that were HEU increased over time. The table on the right shows us that that children that were HIV, living with HIV or HUU, that those that were admitted in the pre-option B+ period were more likely to be HEU compared to those that were living with HIV or HUU. So here we are looking at mothers and the time of their HIV diagnosis, and we can see that the proportion of mothers that were diagnosed before pregnancy increased over time, with those that were diagnosed during pregnancy or at delivery or postpartum decreasing over time. And as we would expect, with mothers being diagnosed earlier, the proportion that started ART before pregnancy also increased over time from about 6% to 62%. Looking at maternal viral load amongst mothers that had a viral load record, the graph on the left shows that amongst children HEU, mothers, about 80% of mothers had a viral load of less than 1,000 copies per mil over time, whereas amongst children with HIV, the graph on the right shows that this proportion was much lower. Okay, I'm just going to go over this very briefly because I'm running out of time. But with CD4 counts, the graph on the left shows that amongst children HEU, the proportion of mothers with a CD4 count of less than 350 cells per microliter decreased substantially over time, whereas amongst children with HIV, in the graph on the right, this proportion was consistently, or most consistently, above 50% over time. So in conclusion, we saw encouraging changes in the HIV-related profile of children with infectious disease hospital admissions in the context of several guideline changes. There were fewer children with HIV and a higher proportion of children HEU. There was an increased proportion of children born to mothers with HIV who are now exposed to maternal ART, and more often from conception. Maternal health improved over time. And finally, we are doing ongoing work to assess the relative risk of admissions in children HEU and HUU, and to identify risk factors for admissions in these groups within this cohort. Thank you very much.
Okay.